If this is a cell has DNA. This DNA codes for some proteins. These proteins go and attach to its specific receptor, and it carries out normal physiology. Okay, to fit in this specific shaped receptor, it should have a specific shape, right? For example, let's say it is in a circular shape, the protein. How its receptor should be like this, somewhat curved. It go and fit here. But think, if it is in triangular shape, the protein had been made in triangular shape. What happens if it is made in triangular shape? Can it go and fit here and carry out the normal physiological action? Obviously no. So what is this fate? What is the fate of this protein then? This protein get degraded by proteosomes and macrophages. Okay, if it is misfolded or formed in different shape than normal, it will get degraded by proteosomes and macrophages. It is a normal physiology. But okay, but think, if these misfolded proteins are created excess in quantity, if they are in normal range, it's okay. But if they are in excess in quantity, what happens? The body cannot degrade them, or it can only partially degrade them. What happens after partial degradation? This partially degraded fibrils form a specific shape named as beta plated sheet. This beta plated sheet go and accumulate in between the cells. In the extracellular matrix, in between the cells, it get accumulated. See, here it will get in between the cells. In between the cells, it will get accumulated. What happened? Normal, a cell has DNA. DNA produces proteins. Proteins has a specific shape and fit to the specific shape receptor, and then take out the activity. But if they are misfolded, they are degraded by proteosomes and macrophages. But if they are in excess quantity, they are partially degraded, and these partially degraded proteins will fold. Actually, these are misfolded. These misfolded proteins will stack upon one another and form a specific defined shape known as beta plated sheet. This beta plated sheet go and accumulate in between the cells in the extracellular matrix. In the extracellular matrix, this beta plated sheet is getting accumulated. So our topic is amyloidosis. Now first we'll discuss about the definition. Okay, what happened here? Amyloidosis is a disease characterized by extracellular accumulation. Here see, extracellular accumulation of misfolded proteins in the form of beta plated sheet and causing organ dysfunction or organ damage. If they are accumulated here, it might damage the organ completely, or it make changes in its functions. So this is the definition. It's very clear, right? Then we'll jump into the next topic. We completed the definition. Then after definition, we said that suppose we said this is the amyloid. Amyloid has specific shape. What is that shape? Beta plated sheet, right? So what is the shape of that beta plated sheet? Like this. In the form of beta plated sheet. Okay, it is in the form of beta plated sheet. This beta plated sheet first we'll discuss about how it looks in the physical properties. Okay, in the physical properties, it has two components. It has, okay, no confusion. First we had discussed about the definition. After definition we are discussing how actually the amyloid look like, how actually the beta plated sheet structure of the amyloid look like. Okay, this is a beta plated sheet structure, and after some space you can give and you can draw the same figure upward also. In the beta plated sheet structure there will be two components. One is, this one is fibrillar component, and there is another component known as non-fibrillar components. This is also called amyloid P protein. Okay, these are non-fibrillar components, these are fibrillar components. Okay, here in the fibrillar component, whenever if you want to see this amyloid, just you want to check whether it is amyloid or not, then you will stain it with a stain, a specific stain known as Congo red stain. Okay, you will stain it with a specific stain known as Congo red stain. What happens after you stain with Congo red stain? This stain goes and attaches here, like this, like this, like this. The stain attaches. Whenever you observe it under polarizing light microscope, whenever you observe it under polarizing light microscope, how it appears? It appears like apple green birefringence. This name is very important. Apple green birefringence. It appears as apple green birefringence. What we had done, we had known the structure of the amyloid, then we had stained it. After staining with a specific stain, Congo red stain, we observed it under polarizing light microscope. How we are able to see it, we are seeing like apple green birefringence. Okay, it's appear like that there will be green apple, right? That color will be imparted. You can search in Google and see the specific image. You will have the infographic knowledge. Okay, now this is the structure: fibrillar component, non-fibrillar component, beta plated sheet structure. Okay, and one more for theory purpose, one more thing, that is the diameter will be the diameter of the amyloid fibril will be 7 to 10 nanometer. This is required for theory purpose. Okay, 7 to 10 nanometers. Then what we can discuss more. Okay, whenever a patient comes to you, and what if you want to suspect an amyloid, what will be characteristics of the amyloid? They may not be confirmatory. We can't confirm it also through physical appearance, but some of the properties of amyloid are: it is film and waxy. Waxy not because it's like that wax like, because it glistens. Whenever we see a shiny surface, right, it will glisten up, glow. That's why it had been given a waxy tag. Then film in consistency, like when we see a not rubber eraser, it will be hard, but in the same way we can bend it, but it is hard, right? That is film in consistency and waxy in appearance. Okay, that are the physical properties. Okay, after the physical properties, now we'll see. This is an amyloid. By how many types of proteins the amyloid can be made? See, for suppose it's not like that there is an X protein, only this X protein in the body will contribute in the formation of amyloid. Not like that. There are many proteins. There is X, there is Y, there is Z, there is A, there is B. There are many proteins. Many proteins which contribute in the formation of different type of amyloid. Okay, the major ones are A L type, A type, then A TTR type, then beta 2 microglobulin, then A cal. Okay, we are discussing that amyloid is made up of many types of proteins, some of which are this, only some of which are this. Okay, now we'll particularly discuss each of this. Where are we are actually in the chemical properties. In the chemical properties we are knowing about by which type of protein amyloid is made up of. First, what is there? AL type. AL type, right? In the AL type, okay, before understanding AL type, we'll discuss one more thing. See, this is a plasma cell. What plasma cell produce? Immunoglobulins. What immunoglobulin does? It takes part in immunity. That's it. Okay, after immunity, what is the fate of this? Those will get degraded or excreted out. But in case there is excess proliferation of these plasma cells, there are many plasma cells produced. Tell an example where many clonal an example where clonal proliferation of this plasma cells will be there. It is multiple myeloma, for example. Okay, in multiple myeloma there is clonal proliferation of plasma cells, due to which there are many plasma cells formed, due to which there is increased production of immunoglobulins. Okay, if it is in the case of multiple myeloma, it is okay. If it is in the case of multiple myeloma, whenever these antibodies are increased, these immunoglobulins are increased, it is called myeloma spike. Okay, it's called myeloma spike. One more thing, see, if this is the immunoglobulin, these are the heavy chains, these are the light chains. This light chains specifically are synthesized in case of this multiple myeloma from this plasma cells. See, actually they should form whole immunoglobulin, but only this light chains are formed. And this light chains, more specifically lambda and kappa type of light chains are formed. Okay, in this multiple myeloma condition, from the plasma cells, two types of light chains are produced more and more in quantity. They are called lambda and kappa type of light chains, which are misfolded. They are created. Okay, this synthesized lambda and kappa type, these are called benzones proteins, which are excreted in the urine. Okay, plasma cells, abnormal light, lambda and kappa light chains, which are also known as benzones protein, they are excreted in the urine. But if you have kidney problem, or these are created in excess, these are synthesized in excess quantity, there will be accumulation of these proteins. How they will accumulate? These chains form fibrils. These fibrils into beta pleated sheet. Okay, beta pleated sheet structure. This beta pleated sheet structure go and accumulate in between the cells in the extracellular matrix, which lead to amyloidosis as our definition. Okay, this is the AL type. This is amyloid light chain type. Why it is called amyloid light chain? It is called amyloid because it is misfolded and leading to amyloidosis. Light chain because light chains are predominantly constituting this type of amyloidosis. So it is called amyloid light chain type of protein amyloidosis. Okay, this is the first thing. Then we will discuss the second thing, that is AA type. Okay, the second one is A type. Okay, the second one is AA type. Okay, let's keep the abbreviation secret. First I will tell a condition. Think there is a disease, there is some bacteria or some virus in the body. This activates interleukins. For example, I am telling just 1 and 6, or just think, okay, interleukins, it activates interleukins. Then from liver, okay, this constitute macrophages also. Macrophages also get activated in an infection. Interleukins are activated, macrophages are there. Then from liver, a protein is released called serum amyloid A. Serum amyloid A. Serum amyloid associated protein, actually, if we extend its name. This SAA will mediate the inflammatory reaction. Why inflammation is there? Because there is some foreign organism in the body, so there is inflammation. This inflammation is mediated by SAAP also. Not only one, this is mediating the inflammation, not like that, but one of the inflammatory mediators is SAAP. After its work as an inflammatory mediator is finished, where it should go? It should be degraded. It should be degraded and excreted out, or ingulfed by macrophages. But in case of long standing infections like TB, rheumatoid arthritis, like TB and rheumatoid arthritis, long standing infections, this SAA is constantly produced and is in high quantity in the body. So this high quantity SAA cannot be degraded fully, because if it is in the normal range, the body can excrete out it normally, but it is in excess range, so they are degraded partially. That partially degraded one of the protein is amyloid associated protein. That partially degraded one type is amyloid associated protein. This amyloid associated protein takes the form of beta plated sheet, then accumulates in between the cells, leading to amyloidosis. That's it. This is AA type of amyloidosis, amyloid associated protein. Okay, then the next one is ATTR. This time also we'll keep the abbreviation secret. Okay, there is a transporter known as transthyretin. In the blood, it transports thyroxine and retinol. What transthyretin does? It transports thyroxine, it also transports retinol. But in case of point mutation of transthyretin, see, what is point mutation? If this is a chain of amino acids, there is mutation in one of the amino acids. See, actually its shape should be like this. Because of this, breakdown in one point, its shape had changed. Only half of the chain is made, and this half. Actually, if it is, it should be actually like this, but it is half the way broken. So it is misfolded. It's not correctly folded. So this misfolded transthyretin will take the shape of beta plated sheet again, and then contribute to amyloidosis. Okay, this is amyloid transthyretin. This is the third type. Okay, then next we'll go to beta 2 microglobulin. This is the major histocompatibility complex. This major histocompatibility complex MHC1 will have two types of chains, light chain and heavy chain. This light chain is continuously dripping out from the this MHC into the blood. Continuously it comes into the blood, will follow from the MHC. So it should be excreted by kidneys. But if in case it is in excess or misfolded due to what genetic reasons, or also in excess quantity, the kidneys somewhat can excrete, but if very excess, only partially they will be excreted. But one more situation, if I have renal disease, my kidney is failed, I can't excrete this beta 2 microglobulin. This beta 2 microglobulin gets accumulated and leads to amyloidosis. That is beta 2. That is beta 2 type of microglobulin amyloidosis. Okay. Because why it happened? Due to chronic kidney failure. What chronic kidney failure patients goes for? They go for dialysis. In the old dialysis machines, means in the some previously, when there were old dialysis machines, the old dialysis machines cannot filter this beta 2 microglobulin. This beta 2 microglobulin in the old dialysis machines, they cannot filter it out. So the person, the beta 2 microglobulin get accumulated and leads to amyloidosis. But in the newer ones, the problem is not there. They will also filter the beta 2 microglobulin also, and some more like acalcitonin in thyroid tumors. Amyloidosis is in acal type, amyloid calcitonin type. Then that's it. Now we'll go to the next topic, that is, till now we are discussing they will get accumulated. What happens if it is accumulated? Okay, now we have to see what happens if it is accumulated. Okay, for suppose, now let's take kidney only, renal artery, renal vein, and this ureter. So this is the renal capsule. These are the pyramids. Cortex, medulla and cortex. Okay. This, whatever the amyloid substance is there, gets accumulated like this. In the renal artery also, in the veins also, in the ureter interstitial cells also, wherever here it's accumulated, here in the ureter, in the renal artery and renal vein. So what happens if it gets accumulated? Let's see, suppose this is the normal architecture of the cell, of the organ tissue. But whenever this amyloid is getting accumulated, this amyloid crushes the tissue shape. So the normal architecture is lost. If the normal architecture is lost, the normal functions are lost. What are the normal functions of the kidney? Okay, let's zoom it out. If we zoom here, this is the glomerulus and these are the capillaries, right? If suppose see this architecture is lost, here I will damage the architecture. I damage the architecture. So what happens? Whatever, for example, see there is a protein albumin or any molecules which should not be filtered, because the filter is made so that macromolecules which are essential for the body will not pass through the urine. But in case where this epitheliums are damaged, this albumin will pass out, other proteins also will pass out, which lead to proteinuria. Proteinuria will eventually lead to, due to excessive damage, will lead to nephrotic syndrome. Okay, what actually the thing is, due to accumulation of amyloid, the normal architecture is damaged. Due to damage of normal architecture, large proteins like albumin get passed out in the urine, so it might lead to proteinuria. Okay, this is the first thing. Then okay, how we can determine that in the urine protein is there? By seeing it, it will be somewhat frothy. Frothy urine will be seen in case of proteinuria. Okay, then the second one is the spleen. In the spleen, this is the splenic artery, this is the splenic vein, and these are the white pulp and this is the red pulp. This is the red pulp and this is the white pulp. This is the white pulp. Due to some mysterious conditions or due to some mysterious reasons which we do not know, what happens, this amyloid get sometimes deposited here, which makes the appearance like sago grains, sago grained appearance. Sago grained appearance, so the name sago spleen. This is the spleen. In the white pulp the amyloid is getting accumulated, so the name sago spleen. Okay, just then just the name, like it appears like sago grains, so the name sago spleen. Then if amyloid accumulates in the red pulp, if amyloid accumulates in the red pulp, what its name is? Its name is Laudacious spleen. Laudacious. Its name is Laudacious spleen. Why Laudacious spleen? See here it is like granules, right? But in the red pulp it is not like granules. It is like, see, like diffused. It's not like granules. Like it's like totally diffused. It's like spreading. Total. It's like totally spreaded. Like back on what? If you see the muzzle, see for example, if you see the muzzle of any chopped mutton, we'll see that reddish areas like this, like spreading. Those are spreading, like that is called Laudacious spleen. Okay, there is nothing much. So what happens if amyloid accumulates? Okay, if it is sago spleen or it is Laudacious spleen, what happens if accumulated? What happens is, the normal function like infections clearing, dead cell clearing, infections clearing, dead cell clearing, like RBCs, and the spleen also stores platelets. Its function also will be lost. The body can't fight infections properly. The body can't remove the dead cells properly. The body in the platelets also, platelets, as platelets are stored in the spleen. This activity also lost, because amyloid is deposited here. As same is in the kidney, here also the cells will be crushed. The normal architecture will be lost. The normal architecture will be lost, and normal functions are also lost. Then there are many organs, not just two, kidney and spleen. Like liver is there, lymph nodes are there, tongue is there, joints are there, and around the eyeball is there. See, in the eye, around the eye there will be deposition, and in the liver there will be deposition. Same everywhere, wherever the amyloid is getting deposited, it will crush the cells, it will damage the normal architecture, then the normal functions are lost. This is the pathology, how it happens. Then in the lymph nodes they get accumulated, in the joints they get accumulated, then in the tongue, in the tongue if suppose this is the tongue, these are the cells in the tongue, it get accumulated like this, the amyloid. What happens if amyloid accumulates? The tongue will swell, means it appears large. That is called macroglossia. It's called macroglossia. We can, okay, it also happens in many other conditions, but in suspected case of amyloidosis, macroglossia is also a sign. Then what else will be there? Microglossia is there. Okay, now I will say a question. In a patient, there is macroglossia, proteinuria, macroglossia, proteinuria, and third one is enlarged spleen. Then one more thing, ECG shows impaired conduction impulses. Okay, what we can diagnose from this? Okay, I did not say the fourth one, I will say it now. See, there is something called senile cardiac amyloidosis. This in the heart, it will accumulate in the ventricle walls. In the valves, it get accumulate. First one in the valves, in the vessel walls, ventricle vessel walls, also in ventricle walls also. Ventricle valves, sorry, ventricle wall and vessel, sorry, valves and ventricle walls. Due to accumulation of this amyloid in the ventricle wall, the wall gets stiffened. And due to accumulation, there is somewhat thickening, right? Due to thickening, there will be decreased capacity. So, see, if it is somewhat became hard, what happens? The heart cannot pump properly, so the blood cannot enter properly or go properly. This comes under senile cardiac amyloidosis. Okay, this is the one more thing. Okay, now you can say the answer for this question. Well, what is this? Macroglossia, proteinuria, enlarged spleen, and ECG shows impaired conduction impulses. We can suspect it as amyloidosis. Okay. Okay, now what are the different types of stains we can stain the amyloid through? One is Congo red stain, which give apple green by in polarizing light. We can also use thioflavin T. We can also use methyl violet, and these are the stains. And what happens in a person who is suffering from amyloidosis? As we discussed, there will be amyloid deposition in the kidney, in the spleen, in the liver, in the lymph nodes, in the tongue, and what else? In the joints. What happens to the patient? As kidney dysfunction, proteinuria, and leads to nephrotic syndrome. In the spleen, infections. In the liver, normal liver functions will be damaged. Then in the lymph nodes it will be get accumulated, in the joints it will be get accumulated, then in the tongue microglossia. So the speech will not be clearer. He will be trying hard to speak that one. These are the things which happen in amyloidosis. And one more thing, I forgot to tell one thing. AL type is called primary amyloidosis, then AA type is called secondary amyloidosis. Why? Because it is occurring after infection, right? SA, serum amyloid A, is produced after infection, so it is conventionally called secondary amyloidosis. Then that is secondary amyloidosis. Okay, that is it. Hello. This is all about amyloidosis. Any more topics? If I had missed anything, you can pin it in the comment. If you like the video, comment below a heart and like the video. And in the future sessions also I will be discussing many other topics from the pathology, microbiology, and pharmacology also.